This is the fourth episode in which we're talking about consent and getting to the bottom of proper services during this journey.
So right now we're getting ready to go through the consent stage, which is basically you have to agree to the treatment that the doctor has prescribed for you. And so I've got all my questions here, and there's been a question of payments and all that kind of stuff, and just procedures, and it seems like it's a very convoluted process to get started.
We will be ordering a test for testosterone and PSA, just to make sure your testosterone is appropriately low at this point. I'm sure it is based on your symptoms, but we just wanted to make sure. At the end of the treatment, we will check the PSA again, and usually most of the time it's way down. That's just to give us a reassurance of our treatment, both therapy, hormone and radiation is working.
And I'm concerned about also that to keep the viability of the apparatus continuously, because I've been doing the research and it indicates I need to at least have an erection at least once or twice a week as a result of making sure that I don't have the lack of blood flow causing a problem for it not working permanently. As far as a prescription for either Viagra, Cialis, or those kind of things, that would be something that you guys would prescribe?
I can do that for you. Do you need a prescription today?
Okay. I want to make sure that I have what I need now while I have you guys in front of me to help to protect my rectum from the radiational treatments. If it's a barrier, it's a azo.
Oh, azo.
Yeah,
so
azo
is more for urinary irritation once
Okay.
you start on radiation.
Okay.
And that's perfectly fine to take once you start radiation. I don't expect you to have any urinary problem right now, right?
No,
Okay.
I don't. No, I don't. But I'm just asking so that I'm prepared properly.
That's perfectly fine. Yeah.
How do I need to prep?
Yeah. So we ask patients in the morning to have a bowel movement. Are you a regular person?
Yes.
Okay.
Yes.
Do you
I'm on a
have
plant-based diet, so I'm
Okay.
very regular. Yeah.
Okay. Do you have a lot of gas?
Not. Sometimes I do. Sometimes I don't. But I'm backing off of broccoli,
Raw.
cruciferous, and beans and stuff like that, so that I
Good.
don't add to. Because I had a previous conversation where I was told that gas is a problem because it's going to
Yes.
move everything and
It
mess with
pushes
the
the rectum towards the radiation.
Towards
So
the radiation,
We don't
right.
want that. So
Okay.
we want the rectum to be as small as possible. Have a bowel movement as once you get up, and about an hour before the radiation treatment, I actually want patients to have another bowel movement. Just go to the bathroom. If you don't have anything in terms of stool, at least expel some gas, whatever, and then start drinking. So we want people to have at least about 25 ounces of water 1 hour before your radiation treatment, so that your bladder is appropriately full during the treatment.
Okay, so and being exact with my particular situation, what I do is when I wake up in the morning, I'm having about three tall glasses of water in the first place
Okay.
to kick off my bowel movement in the first place.
That's fine.
Is that fine?
That's
But
fine.
then but when I come here for the bowel movement, I may end up urinating, but I'll need to refill the
Refill
the bladder.
Yes.
Okay.
And don't have a bowel movement too close to your radiation treatment, because as you said, people usually pee and poop at the same time, and then you empty your bladder.
Okay.
But
Okay.
it's okay if you do, because if you do it early enough, just drink water and refill your bladder.
No, I have one concern. So we've been through this process a couple of months, and I think we spoke to Dr. Song our first time we came through the clinic, and every time we want information, there are all these different people that are talking to us, or we're not getting timely responses to our questions. I want our expectations to be in the right place. So I feel
Yes.
like I've been very frustrated because I know he uses the portal, and one nurse will say something.
Regardless if you're being treated at Green Spring or here, Dr. Song will meet with everyone on treatment every single week.
Okay.
Just manage the side effects and talk about things.
Perfect.
Okay.
Yeah, so
Well,
that's
see
so
that
you
we
will
didn't
see
know
him.
that. Nobody
See,
really
no one
told us
That's
that.
insane, yeah.
No one told us. That's why I'm asking you about follow-up and side effects, because
Yes.
nobody has told us that.
I'm sorry.
And I have to be an
Well-
advocate for my own care. This is my life, man. So I'm
Absolutely.
just saying.
I understand.
So, okay. So
Yep.
every week, then he'll
meet
be
with-
managing things and managing side effects and all that kind of stuff.
Yep.
That's very good to know. Okay, yes.
Okay, with Dr. Song
With
himself.
Dr. Zhang himself.
Nothing against you.
I understand. I
Okay.
understand.
Okay. All right. Okay. Now I'm
Yeah, that's much more comfortable.
So essentially it says Dr. Zhang is the doctor who is going to supervise the entire treatment course
Mhm.
for your prostate cancer.
Gotcha.
We have to specify which side the treatment side is located on. It's in the middle. The prostate is in the middle, so it's not on the left or right side. The goal is to kill all the tumor cells and prevent any growth in the prostate itself.
Okay.
And there is a long list of potential side effects. I'm sure Dr. Sun probably talked to you about the most
Right.
significant and important ones. And overall, our patients tolerate this treatment course very well.
Okay.
I'm sure do you have side effects from hormone therapy? That's
That's
unavoidable,
inevitable.
unfortunately.
Yeah.
In the short-term side effects, including the urinary frequency, loose bowel, things like that, fatigue, which you probably experience towards the later half of the treatment, those will go away after you finish.
Okay.
What we really worry about are the long-term side effects.
Okay.
And as Dr. Sam probably told you, there are mainly 3 categories of long-term side effects. You may have bleeding from the urine as well, or
Urethra?
I'm
Through
sorry,
the urethra, you saying?
urethra or bladder.
Oh, bladder. Okay.
Yes.
Okay.
Again, that's very rare, and occasionally a urologist might have to do the same thing, use a camera to cauterize whatever is bleeding. But again, that's probably on the order of 1 to 2%. More commonly, people have side effects in terms of sexual function afterwards, and I think the things you said would be to make sure you continue to have erections and things like that would probably help in the long term.
So that's why the actual Viagra is actually important to try to maintain the blood flow and everything like that.
Yeah.
So it's not a permanent side effect.
Yeah. I
Okay.
think that's
All right.
totally reasonable.
Okay.
Besides all those, there are potentially very rare side effects like fibrosis or stricture or the urethra or the rectum, which would be extremely rare. Weakening of the bone in your hips, which may predispose you to fractures in the future. And part of that is also from the hormone therapy as well. So if you are physically active, I would encourage you to continue to do so. Exercise every day, walking is especially good.
Okay. I'd also researched that weight-bearing exercises would be essential.
It would be great. Yeah.
Okay. So I need to prioritize weight-bearing exercises and walking.
Yeah.
Right. Okay. I can do that.
Excellent.
All right.
The last one would be in extremely rare occasions, the radiation itself can cause cancer, as you
Right.
probably
I've
have
researched that.
aware.
That's down the road possibility.
Yeah,
I've seen
would
that's
be
a possible recurrence within like a 7 or 10 year space of time, depending on your health and your age at that particular time with the exposure.
So I think we're talking about 2 different things.
Yeah.
Oh, okay,
Uh,
okay, all right.
Yeah, there is a possibility that the cancer can come back even after
Right.
radiation. And
Oh, no, I
therapy.
wasn't talking about the cancer
Oh,
coming
okay.
back. I was talking about what you said, a side effect, which is a
Another
different type of cancer.
Different kind of cancer.
Yeah,
Yes.
that.
As you said, it usually happens later down the road, on the order of 10 to 20 years down the road.
Oh, okay, 10 to 20, okay.
And the chance of that happening in someone, you or me, would be probably less than 1%.
Okay,
So
all right.
not a huge concern at this point.
What's the level of monitoring after he's done the whole, the process, 8 weeks or I don't know if it's 8 or 9 weeks, whichever we're doing. So
Right.
how often is it? Every 3 months, like
Every 6 months, you will have a PSA test.
Okay,
and
so
Dr.
after
Sam
all
will
of this,
see you.
okay, 6
Yeah.
months.
Yeah, at
Okay,
least for the first several years.
Okay.
okay, all right.
Uh,
That, particularly in the part where it talks about the hormone therapy,
mhm.
that I have to make sure that I take it every single day.
Mhm.
But if I skip a day or something, that means I have to start the whole cycle over again with the hormone therapy. You know what I'm saying? I mean, he scheduled me for
Good
for
question.
24 months in a
Yeah.
row, and I'm making sure that I'm doing it every day. But
If you skip one day, I think
one day
it would
won't
be
kill me,
okay
but I'm not
for you
going to
to
try
resume
to.
it.
You know what I'm saying? But I'm
Yeah,
just
I
saying,
know.
I want to get it over with. I want to get all all those things out of the way as quickly as I can.
Yes.
But just in case for some reason I may forget one day, that doesn't mean like, oh no, now I got to start a whole new.
Oh, 24 months. No.
Okay.
Hopefully I answered all your questions today. This I think will show up on my chart. If it doesn't, first time you come back, you can ask for it.
Okay. All right.
That's it.
That's it.
I will let the therapist know, and then they'll come get you for the CAT scan.
Well, I feel a whole lot better now. I just, I mean, this is just the consent part, but there was a lot of education, a lot of stuff that we went over. I think right now, I mean, we're getting ready to do another MRI and set me up.
And CAT scan, right? You're
Right.
gonna do both. He said the CT scan first,
CT
then
scan,
MRI.
then MRI. So we're getting all of them done together. But I think it was very important that we weren't necessarily mad, but we were assertive.
Yeah.
And if you're not going to be assertive about how somebody treats you and you're a paying customer, that's your fault. Because the bottom line is this is still a business. There's paying customers, right?
Yeah.
And I'm not asking for special treatment. I'm asking for customer treatment.
Mm-hmm.
But I didn't know I needed a witness. I'm glad I had a an app witness. Yeah. Felt like I was signing my contract for the Indianapolis Colts with their new running back.
Oh wow.
Taylor Part 2. Anyway. So the consent part is over with, and hopefully me sharing this experience and the questions that I ask, and you can't be shy about it, guys. And the bottom line is the hormone therapy will drop your testicles from producing testosterone. I have been quite fortunate so far in the treatment where it hasn't affected me directly, but rather than wait for the effect to kick in, I'd rather have the medicine. Look, I'd rather have the Viagra, and I'd rather have it and not need it than need it and not have it. Now she wants to chime in, of course. And you know what? We are joking, but you know what? I'll tell you what's made this process a lot easier. Being extremely open and as having as much of the clinical experiences with your partner helps take away from the edge of the scariness. You don't handle it by yourself. And she'll remember, believe me, your partner will remember whatever question you forget to ask, your partner will answer. No matter if your partner is a he or a she, believe me, your partner will ask the question that you have forgotten to ask, okay? It's kind of like having a coach. Even Michael Jordan needed a coach, right? You can't remember everything.
That's right.
Yeah, because it is a team effort.
Teamwork makes the dream work.
It sure do. We're going to get some Viagra. I'm sorry. Hopefully this helps you out.
The next step, actually going through the treatment itself.